Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 8 new cases of COVID-19 in Windsor and Essex County. 3 are community-acquired, 1 is a close contact of a confirmed case, 1 is travel-related outside of North America, and 3 cases are still being investigated. We have had 16,817 cases since the beginning of the pandemic. 59 people are active at this time, with 12 of our active cases being a variant of concern. To date, 1,961 preliminary or confirmed variants have been identified in Windsor-Essex County. 11 people are currently in the hospital and 7 people are in ICU. Our community has lost 434 people to COVID. There are currently 2 outbreaks in Windsor-Essex County, 1 workplace outbreak and 1 community outbreak. Regarding our vaccine update, 272,044 people have received at least 1 dose of a COVID vaccine. Overall, 74.1% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID-19 vaccine. 145,423 people in Windsor-Essex County are now fully vaccinated. That is 41.7% of our adults 18 years of age and older. Those 18 years and older who received their first dose of an mRNA vaccine on or before June 2nd are able to book their second dose of an mRNA vaccine at one of our mass vaccination clinics, participating pharmacies, and primary care providers. You must have a minimum of 28 days between your first and second dose. Youth 12 to 17 years of age are not eligible for a shortened dose and must wait 8 weeks to receive their second dose. Today, the Unemployed Help Center at 6955 Cantillon Drive is hosting a COVID vaccine walk-in clinic from 8:30 till 2 p.m. Another clinic is planned for Wednesday, June 30th from 9 to 3. Individuals aged 12 to 17 years of age are required to register in advance by calling 519-944-4900, extension 166. We are holding dedicated youth times tomorrow and Wednesday for those 12 to 17 years of age. Youth are able to book an appointment to receive their first dose of a Pfizer vaccine on Tuesday, June 29th, and Wednesday, June 30th, between 11 a.m. and noon at the WFCU, Libro, and Nature Fresh. In addition, when the mall opens up in Stage 2 on Wednesday, the vaccine clinic at Devonshire Mall will be offering special walk-in times for youth to receive their first dose. Signage and notifications will be in place, but we wanted you to be aware of this option as well. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Today we have achieved another milestone. We now have more residents that are fully vaccinated compared to those who are partially vaccinated with only 1 dose. Slowly and surely, we are ensuring that all of our residents are fully protected. I anticipate that more than 50% of the adults in our region will be fully vaccinated sometime next week. With more and more people vaccinated, we can certainly look forward for a 2-dose summer for all of us. I truly believe that we have survived the worst of the pandemic. We were in the eye of the storm in January, but now we are in a clear zone. We shouldn't be in this area in the zone if we didn't had you as the resident of this region supporting our work and rolling up your sleeves to get the vaccine. For those who are still contemplating either their first dose or second dose, please do not wait further and get your vaccine as soon as possible. On Friday, the Public Health Agency of Canada released their guidelines for individuals who are fully vaccinated. Please note that this is a broader guidelines for the entire country, and we are still waiting for our provincial government to issue further details on what it means for fully vaccinated Ontarians. We expect to see the guidelines coming in tomorrow. Please continue to follow the public health measures until those guidelines are received. Thank you.
We'll now take questions from the media. Today we'll start with AM 800.
Dr. Ahmed, just talking about the milestone, not sure if Teresa wants to answer this too, but a lot of hard work, a lot of effort. Obviously the beginning of the pandemic, but when the vaccine rollout started at the end of December, just hitting this milestone, what does it mean to each of you?
I'll let Teresa comment. I think she put a lot of effort in that, so over to Teresa.
I think a lot of people have really done a lot of work to come to this point, and yeah, it just feels good. We are getting more and more people vaccinated, and with the help of our hospital partners, Windsor Regional Hospital has been amazing and continue to do a great job. We know our municipal partners, both the city and the county, Amherstburg, Leamington, continue to support our efforts. In addition, we have all of these pharmacies and primary care providers. So great job to everyone, and the vaccine clinics are really, they're being booked and people are accessing them and getting vaccinated. So it feels great, it feels really good.
How did the weekend go for booking? I know the website went down there for a little bit, but overall, hundreds, thousands of Windsor-Essex residents signed on to book?
Yes, so I don't know the exact number, but it did go down for a short while. And Mike told me not to put out an announcement because he said it'll be back up and running momentarily. So great job to our staff. And but yes, everything is getting booked, and so opening up to this, next group, which is basically everyone who's been immunized more than 28 days ago. It's good. We'll continue to open up more spots and get everyone with their second doses, and people who require a first dose. Availability is there as well.
And finally, I'm not sure if you have this in front of you, if you can provide it during Wednesday's update, but how has the businesses done with the reopening? I know the first week you said there was 4 fines, charges laid. Do you have an update there?
So I don't have an update for the immediate weekend that just passed, but I know in the previous week that we did have one charge was laid, but I also know that according to our manager that oversees the tobacco and vaping enforcement officers who are out there with the reopening and have been the ones on the ground, and in addition to our public health inspectors, that there's a lot of education out there. The businesses are complying because they want the business. The restaurants want the business. So everyone is keen to open up safely and stay open. So according to what I've heard, everyone is wanting to be in compliance, and really good overall compliance in our community, which we're really thankful for. So everyone is taking this seriously, and businesses are being proactive and asking the right questions to get the right answers to make sure they're in compliance and doing things accordingly.
Thanks, Teresa. One quick one for Dr. Ahmed. Dr. Ahmed, I'm not sure if you can tell us this, but just looking at the cases in hospital and the ICU, seems like it's going up from the past couple of weeks. Can you tell us, and like I said, I'm not sure if you can, if these individuals have been vaccinated at all?
Yeah, no, we usually don't have that information handy because the two systems don't talk to each other yet, and we have to go through the manual process. So once we are aware that if there is someone who is in the hospital, and when we are investigating any further details on those cases, we do look at their immunization record. I don't have that in front of me, but all I can tell you is quite a lot of time what we are seeing more recently is these individuals are not necessarily admitted for COVID, but at the time of their admission, they are tested, and then they are found to have the virus in them, but not necessarily in a way that COVID brought them to the hospital. So we'll have to look into that, and it's hard to report that data on the real-time basis, but we do look at that information when we're investigating.
Thank you.
Any questions from CTV?
Just regarding the local hotspots that we have do we currently have people on the ground right now promoting the vaccine, or are we still focusing on the mass vaccination clinics, and then we will continue to focus on that moving forward?
So I'll start, and then maybe Teresa can add. Short answer, yes, we have people on the ground that are already working in that initiative, and to just do the outreach and make that connection. There are many community agencies and groups that are working, but I'll let Teresa maybe explain a little bit more.
I think that's exactly it. We do have the CMHA is leading the initiative through the high priorities communities grant, and the outreach on the ground into these areas is occurring, and more work will be done, but they are working with that. And as Dr. Ahmad said, with all of our community partners, and making sure any barriers that are identified are being addressed. And we know that we have some good practices in place, such as transportation if people need it, childcare is available if there's an identified need, and translation service as well on site. So we're hoping that further outreach into the communities will help get more people vaccinated and help them overcome anything that we're not aware of.
Thank you. And there was also an incident in the Home Depot parking lot over the weekend. 2 people allegedly overdosed. A lot of police presence there. Just again, how real is the overdose opioid addiction here in Windsor-Essex? I mean, it's one thing for it to happen in someone's private home, but now, we're seeing a case where it's happening very publicly. What are your thoughts on that?
So it's really unfortunate and a tragic event as we continue to see the impact of opioid in our community and in many other communities as well. The pandemic obviously has exacerbated that problem with many related issues when it comes to mental health, when it comes to people who are living with addiction. And it has been really hard on them. And we as a community, obviously, we are concerned. There are a number of work that we are doing as part of opioid awareness. Teresa has been engaged actively in the supervised consumption side. So there are many things that are happening, but at the end of the day, these are the people. These are the people who are dying. These are not any specific individual that we can stereotype them, or we can say that it's not a problem for us and it's not a problem for me. It is a problem for us because it's happening in our community, and it is happening everywhere, in the homes, in the parking lots, in the alleys, everywhere. And we have, as a community, have to come together to find some solution to it. There is no simple solution to it. And something that we'll continue to work on as we progress through this pandemic. We have another epidemic in our region, in the province, with opioid, and we must address that as soon as we can.
Thank you.
Any questions from CBC?
Yes, good morning. I'm wondering if you have any details to share about the outbreak at the mission.
At this point, I don't want to share lots of detail. The only thing that I can say, up until Friday when I was briefed by my team, we had one case, but there was some high-risk contacts that we are trying to follow up and making sure that it doesn't spread further. There has been some efforts that already happened in terms of the vaccination, so we're hoping that it doesn't lead to anything major, but ensuring that we are putting all these measures in place. We erred on the side of caution to declare the outbreak and to contain it as quickly as we can.
Thank you very much.
Any questions from CFTV?
Yes, good morning. I was just wondering if you have an update on the development of a vaccine for kids that are under 12.
So I don't have an update. We'll probably hear about those vaccine in fall. So I don't even anticipate anything happening during the summer. And there has been some ongoing research in even in younger children, infants, and even like under 6 year or under 5 years old. So that work is ongoing, but we probably won't hear anything before we get into fall.
Okay, thank you very much.
Any additional questions from AM 800?
Teresa, one quick one in regards to booking. So, for example, now that it's basically opened up to everyone that has received their first dose and eligible for second dose as well, if someone has an appointment scheduled at a later date and they get an earlier appointment, do they still have to cancel it, or does it automatically cancel on its own?
No, they do have to cancel it. So on the booking site, it'll say view or cancel reservation, I believe it says. So if they get an earlier appointment, just go back in and cancel it. Or if they're calling the the call center to book their appointment, they can tell the call center, ask them to cancel the appointment. But they do have to cancel that appointment if they receive an earlier one. And I just wanted to go back to the topic about the safe injection site. I just want to remind people that we have a survey out there at WECOSS, WECOSS.ca. And it's regarding the site selection for the consumption and treatment services site for the completion of our application. And so if people could please have a look at that survey and get more information. And this is one strategy, as Dr. Ahmed said, in dealing with substance use in our community. And just want to remind everyone that we do have that survey regarding the site selection. We have 2 sites there, and we would really like your input and feedback. So thank you.
Thanks, Teresa.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from CFTV?
No, thank you.
Thank you, everyone. See you back on Wednesday.